Nós estamos aqui finalizando o 17º Encontro Nacional de Radiologia Cardíaca, mais um sucesso, casa lotada. Estamos muito felizes de poder ter recebido todos os radiologistas e cardiologistas do Brasil que fazem o método. Eu estou aqui com o nosso amigo Andrew Arai, um dos maiores experiências em ressonância e tomografia cardíaca do mundo, parte do SCMR, que está aqui conosco. So Andrew, I would like to ask you to make some highlights of your participation here and also about the meeting.
Well, it's always a pleasure to go different places, but it's almost always the people that make a difference. One of the things that really impressed me about the meeting here, well, like most meetings, the quality of the presentations was excellent. But what really impressed me was how many people from the audience asked questions, and good questions, not just a quick, can you clarify something? These are thoughtful questions that led to answers from 2 or 3 of the experts at the panel. So a half hour of discussion after 4 or 5 lectures, you don't see that at very many meetings. That was different and that was special.
And if you could talk to us about how do you see the future in short words about the MR, cardiac MR and cardiac CT.
Well, I think, the future is always hard to predict. I've been doing cardiac MR since 1994 and, there was 0 basically cardiac MRI, maybe a little bit of congenital heart disease at that time. And so it's made it farther than I expected, but it's still behind many of the other fields. CCTA, on the other hand, is at a major crossroads. It really is at the stage where you could argue it is the first test we should be using for evaluating patients with chest pain. It's not perfect, but there's no easier test to rule out epicardial coronary disease. And that is a really powerful idea. When you look at the stress tests, you always wonder a little bit, well, did I have an equivocal stress test? Was the vasodilator enough? Did they have caffeine? Or they all barely made their heart rate limit? Or the ECG has some mild findings, but they're not specific. All these things add some doubt. And when you have low pretest probability of disease, those add up to many errors. CTA for a normal is really highly specific.
Nós queremos finalizar e agradecer a todos pela participação no nosso encontro e desejamos um bom descanso e um próximo evento. Gostaríamos de contar com vocês no ano que vem para o 18º Encontro Nacional de Radiologia Cardíaca.